Hello all, this is Dr. Dheeraj Masapu. I'm a senior consultant in the field of neuroanesthesiology, and this video is about what mistakes you should not do during the counseling which is going to come up now. So there are some elements I would like to cover here, which actually covered in some of my videos. So the number one area which I would like to talk about is you need to understand why you are actually taking that particular specialty. For example, some specialties, people will take it for a prestige or income potential, like, prestige like radiologist or dermatologist or orthopedician or something like that. So, or, some people would think that general medicine is more prestigious. So rather than that, what I really feel is you need to actually, understand what kind of person you are. And if you're a kind of person who actually like fast-paced life and more decisive kind of a person and, can manage crisis, you can actually think about going into emergency medicine also, and even anesthesia and even into intensive care medicine. So that is the kind you have to understand what kind of a person you are rather than going into the prestige and trying to impress people. What I really feel is you have to go into areas based on your interest, and basically you have to, when you are doing your internship, some of the areas you would have loved, right, in working, those are the areas you have to take out and then take the decisions. That is one way of doing it. And the next mistake that people do is basically they don't understand what kind of demand that the specialty requires. This is the common mistake everyone does. See, what I observed is some specialties like anesthesiology, psychiatry, dermatology, and all are more predictable, time to time and shift based, and you work and in a shift and go. But there are some specialties which are extremely demanding, like surgical specialties mainly. Okay, if you take OBG also, it's very demanding specialty. So if you are not having that kind of physical and mental capacity, it would be very difficult to cope up with the schedules. Okay, later on, if you crib and if you cry, I'm not able to cope up with the stress, then nobody is going to rescue you. You have to understand that they are going to be tougher. Okay, so this is another mistake that people do. They will imagine that their capacity is unlimited and they'll take it, and after that, some people adapt and they survive, but some people won't be able to do it. So again, it's a personal call. You have to understand who you are. Okay, that is a very practical advice I would like to give you. Again, here you have to understand, based on your past experiences. And third important thing is financial goals. See, some people are from a lower middle class or from a poor socioeconomic background. Some are from a rich family or upper middle class. So that matters here, because I don't want to talk about all these things, but I have to tell you that matters. See, if you have some financial commitment or some kind of instability in your family, then specialties which can give you immediate stability are very useful, like anesthesia or radiology. You immediately get some kind of a good salaries there. So those specialties are more useful. And surgery specialties like, super specialty, neurosurgeon, I want to become, cardiac surgeon, I want to become. It might be a dream for you, but the thing is your family is in trouble, right? And you don't have the support from the family. So then, and you maybe sometimes you might have to support them. So in those kind of circumstances, it doesn't make sense to go into that kind of specialty. If you are from a rich background, then it makes sense. You can go to general surgery, then you can again prepare for MCH, and then again 3 more years you can do MCH. Go to some abroad country, do some training, fellowship, and some skull-based surgery, that surgery, this surgery, and you can come back, set up your OPD. There is ample amount of time. Since you don't have to support anyone, that's a different story. But not everyone's story is like that. So this is another important aspect you need to consider. There is no wrong in taking, small specialty. There is nothing like small specialty, big specialty. That's all a myth and paradox. People don't understand anything about the medical careers, talk all these rubbish things. Every specialty is same. Every specialty, you take any specialty, if the person has the capacity, they will grow. I've seen people in anatomy making their own YouTube channels and making billions of dollars. Okay, there are people in neurosurgery who are not earning any money. It's not about specialty, guys. Okay, don't take a specialty and prove to society that you have done some great job. The job actually starts at that point of time. You have to grow your CV. You have to build your CV, do publications. It's a different discussion. We'll discuss later. Okay, the next important thing is don't over specialize too early is my recommendation. See, some people directly are taking up neurosurgery, cardiac surgery, pediatric surgery, 6-year programs. See, for example, when you're taking the decision, you're very young, right? Okay, so but the thing is, after taking up, you didn't like it. Then again, many people actually leave and go. Rather than that, what I recommend is you take up general medicine or general surgery, or work for 3 years, and then you understand how the surgery works. And then you go for a rotation, right? Then you will be fascinated by some area like gastro, or I want to become a pediatric surgeon or something like that. Then choosing after a certain age and experience would be more wiser, I feel, than over specializing very, very, very early. Okay, hope you got my point. Okay, I don't want to bore you guys. I will go to the next topic. The next important thing, and I stress in all my videos, is understand the demand supply, please. Because just because you like something doesn't mean that it is in demand. Okay, sometimes you have to do stuff even if you don't like it. Understand, this is the rule of life. Okay, there are some high demand specialties which are going to come in demand, like physical medicine, rehabilitation, emergency medicine, nuclear medicine, and all that. So because the reason is that people are less, right? It will be demand for some more years. After that, again, it will also get saturated. So thriving in a competitive market is very tough. Thriving in an area where people are less is easy. So you have to understand that thing. And most of the times, in general medicine, pediatrics, radiology, and dermatology, all toppers would take, and they compete among each other. So in specialities like this, the competition also is a little lesser. I don't call below average people, but rank wise, your rank is a little lesser, so the competition also would be slightly less. So anyway, the demand supply math, you have to understand which areas are in demand, where supply is less, you have to enter those areas. That is my sincere recommendation. Many videos I did in that area, and even I can cover individual videos also. No, you can go into my playlist and you can see. Okay, and choose the specialty based on your attitude and aptitude. Okay, for example, you are a robust, resilient guy, you're like a beast, then go for these 6-year courses of neurosurgery, cardiac surgery, pediatric surgery, and all that. If you are mild guy who can't take that kind of stress, not so resilient, but intelligent guy, but can't take that kind of pressure, and if you succumb to the pressure, then you don't go into such kind of specialities. Okay, go for a simpler specialities where some kind of balance is there. Okay, like radiology or something like that, and dermatology is also a good option. And so these are some of the mistakes that people do, and I feel if you can keep these things in mind when you're choosing the specialty, it would help you. Okay, so then so many videos I did, you can go into my playlists and you can see all those things. And so that's it, guys, and you join the channel. So many exclusive member only videos are there. Next is nuclear medicine, and some of the DNB hospitals, best hospitals are also for members. You can actually go into the member section and see those videos. You have to join the channel. But okay, thank you guys, thank you very much for following the video till the end. Bye.